Hi, my name is Ash, and this presentation will go through HFMD, hand, foot, and mouth disease. We will go through what the disease is, as well as the causes, treatments, and the approach you as a parent or caretaker can take when dealing with this disease. So what is HFMD? Hand, foot, mouth disease is a rapid developing infectious disease. By nature, it is low in virulence, but highly contagious. This disease is very common in children, especially under the age of 5. HFMD can also be caught by adults, but this is significantly less common due to immunity that is developed at a younger age. As the name suggests, HFMD primarily affects the hands, feet, and mouth regions. It may be identified by visible rash-like papules located on these areas. Amongst this, HFMD is also symptomatic with fever, pain in the throat and the mouth, headaches, and loss of appetite. HFMD is mainly caused by the Coxsackie A16 virus, but can also be caused by the enterovirus 7.1, as well as other Coxsackie variants. This virus is highly contagious and can be transferred through direct contact from the infected individual through oral ingestion. This can be done through saliva, blister fluid, stool, or respiratory secretions. HFMD, caused by Coxsackie A16, is usually mild and self-limiting. Symptoms usually last between 7 to 10 days. However, if the causative agent is the enterovirus 7.1, the disease may progress to more severe and complicated diseases if left untreated. This may potentially lead to cardiopulmonary and neurological complications. The disease caused by the enterovirus 7.1 have the same initial symptoms as the Coxsackie variant. If the disease progresses though, a unique set of symptoms are presented and can be fatal. These include myoclonic jerks, trachypnea, bradypnea, and hypertension. Regardless of the causative virus, the treatment options for HFMD are generally the same. Unfortunately, there is no cure for the disease as of today, but due to the self-limiting nature of HFMD, the disease is usually dealt with by the increase in the immune response of the body. Treatment therefore lies mainly in symptomatic relief. There are a variety of OTC medications that can be used to relieve discomfort and pain that is caused by the disease. On top of OTC medications, recent developments in Chinese herbal medications have been proven to be effective symptomatic treatments, as well as reducing the recovery time from HFMD. This can also be used in conjunction with OTC medications to provide more effective symptomatic relief. So now, as a parent or caretaker, what is the best approach that we can take for HFMD infected individuals? There are two things that we can do. The first approach is to encourage proper hand washing techniques. A study has shown that this can reduce the risk of getting the virus by 95%. Hand washing is also important to stop the spread of the virus. Once the symptoms are not present anymore, the virus can still remain in the body for weeks, making the individual still highly contagious. Second and lastly is to actively monitor the individual. Even though the disease is self-limiting, we should be watchful for any unusual symptoms arising. If they do, an appropriate health professional like a GP should be consulted.